Assalamu alaikum wa rahmatullah wa hayyakum Allah jami'an. I'm super excited about tonight because we have an extremely important topic for the better half of emergency medicine. We've had two emergency medicine interest group discussions so far, but I think this one will actually be the best to date. We have the pleasure of hosting a superstar group of Saudi women leaders in emergency medicine. And honestly, I would need an hour to present them all along with their credentials and accomplishments, mashallah. So I'll stick to introducing them with their current roles, and you can see their full credentials on the slides as they lead topics. Dr. Wejdan Alassaf is a consultant emergency medicine, EMS and disaster medicine at King Abdullah University Hospital, as well as the head of the disaster medicine department in the same institution. Dr. Abeer Ghawnni is a consultant emergency physician at King Faisal and in Riyadh, and she is the program director of the emergency medicine training program there as well. Dr. Baian Alabdulbaqi is a consultant emergency physician and a toxicologist في مستشفى الملك خالد الجامعي. Dr. Hanan Alzeer is a consultant emergency physician في مستشفى الملك خالد الجامعي. Dr. Sameerah Alsomali is a consultant emergency physician at National Guard Hospital in Riyadh and is the program director for emergency medicine training there. And Dr. Layla Abubshait is a consultant emergency physician at Jefferson University and is the associate program director at Albert Einstein Medical Center in Pennsylvania. And last but definitely not least, we have four of our awesome residents at King Khalid University Hospital. Dr. Esraa Bakhsh, she's an R3, Dr. Bashayer Almousa, R3, Dr. Sara Almubrik, R1, Dr. Rawan Ghandour is an R1 in our program as well. I hope everyone's prepared for a great deal of learning from this awesome group's experiences, knowing that the majority of what applies to women in emergency medicine will likely apply to other specialties. Based on past discussions, this will take around 2 to 2.5 hours. So please enjoy and learn as much as you can. But if one of our guests or attendees have to go, we completely understand. Each topic will have a leading guest that will answer the questions related to the topic that they're leading from students. So once we begin each topic, you can send your related questions to all panelists and attendees in the chat section, as I've already sent a message in the chat clarifying that. If time permits at the end, we can allow our other panelists to share their experiences in topics led by other panelists. From this moment on, I'll be an observer only, and Dr. Hanin will be leading the discussion between the students and our guests. So Dr. Hanin, please go ahead.
شكرا دكتور فهد، حياكم الله جميعا. شكرا دكاترة على الحضور اليوم. متحمسين، وزي ما شفنا دكتور فهد بإذن الله أي سؤال بالشات، وإن شاء الله. Are we good to start ولا؟
Yeah, I think we're good to go.
Okay.
All of our panelists are here.
Okay, so I think the first topic is the most concerning one صراحة. So حنبدأ إن شاء الله مع دكتورة ليلى. أهلاً دكتورة ليلى، تفضلي.
أهلاً فيكم. السلام عليكم ورحمة الله. Thank you very much for having me today. I am humbled to be part of this amazing group of women in emergency medicine. It's ironic that I got this topic, work and life balance, because to be honest, this is one of the topics that I struggle with the most. And I have been trying to learn new techniques as I move on in my career. And there is no, I'll tell you the real deal, there is no one way to do it. There are multiple ways to do it, and it all depends on your personality and your lifestyle. I did this. Is it possible for me to share my screen just to show you a small diagram? Oh, I won't be able to do it. That's fine. So when I was in, oh, go ahead, Hanin.
Yes, you can share your screen now.
Oh, thank you. Okay, there we go. Alrighty. So I'm not an artistic person at all, okay? But can you guys see this one? Someone say yes anywhere. Let me see, where are my messages? Okay, awesome, great. So in medical school, so I went to Jamiat Malik Faisal in Dammam, which changed names throughout the years. And there was an amazing professor who was from Sudan. He was excellent. He was smart. He was teaching us all kind of things in hematology that I have no idea what it was. And without him, I would have never passed my course. One advice, though, that he told us is you should always follow the 50-50 rule. And I regret to say that this is the worst advice that he ever gave me, because you can never do a 50-50 rule when it comes to balancing your home and work. And the reason why is that we tend to forget that part of our home is this. All right, it's not just home, it's your finances, it's your family, it's your health, it's your friends, it's your personal development. You want to learn things out of medicine too. You want to be, I don't know, great in photography, in music, and cooking. So to only give 50% of your time for all of this together is not a good advice. We all try to get to this. We all want to give 50% of work and 50% of life and, you know, the rest of the things, family and friends, but it will never happen. And that is the main thing. That is the one thing I all want you to understand, that it is not about 50-50. So let me close this and let's stop sharing. I would like to hear more from the panelists that are sharing this with me. Throughout our discussion today, I'll give you tips of things that I've tried throughout my life that worked and things that did not work. Obviously, the 50-50 percentage did not work at all. What honestly worked for me is, number one, don't be hard on yourself. There will be days where you do amazing at work. You published a work, you saved a patient's life, you got a nice compliment or comment from a patient or their family, and you suck at home. You come back home and your kids are like, they turned the house upside down. Your partner is upset at you, your parents are upset at you, you forgot your best friend's birthday, you could not attend your best friend's wedding, and you lost your 50% there. So don't be hard on yourself. There are days where you'll do great at work and you're bad at home. And there are days where you do amazing at home and you did not do very well at work. That's my rule number one. My rule number two is take it easy. You know, the type of people that go into medicine are, we like to call them personality A's, although not all of them are, but we all have that, you know, the sense that we need to achieve. I need to be the top of the top. I need to be the best person who's going to do this. And I want to be, and I want to be. And unfortunately, when we do not get to our goal, to the goal that we set for ourselves, we tend to get very hard on ourselves. We shut down, we get depressed. And that's unfortunately one of the things that can affect your work and life balance. So I'll stop right here and I'll give a chance to the rest to give me their opinion.
I just want to clarify something. Is the voice clear? Can everyone hear Dr. Layla? Okay, so then the issue is from the person who sent me the message saying that there's a problem with the voice. It may be with your phone or computer. You may need to log out and back in, and make sure that you connect to Wi-Fi and cellular if it's through the phone. Go ahead.
Does anyone like to add to the work-life balance? Any tips that you guys tried that helped? Because I want to learn too.
I believe Dr. Baian has comments. Go ahead, Dr. Baian. You don't need to raise your hand.
أهلا مرحبا. How are you everyone? There is a couple of points I want to I just want to not necessarily add. What Dr. Layla said is absolutely right, because you just have to think of life a truly dynamic thing, and the status from where each point you are, it's not necessarily can be calculated in math. From a practical point of view, from my experience, a lot of intern or student, when they come to the emergency in rotation, they have a very, very heavy and rich experience, and the exposure in medicine is so attractive, I would say. It's so, it sucks you in, because you learn a lot and you can do things, and you feel how important you are. But then when they live for 3 months on shift work, that's where the reality hit. And so, and there is another point also I heard from a student and intern. They would calculate the number of hours of working. So thinking that in emergency you get more off days and more off work days might not necessarily true. Even if you calculate the work as the on-call, this is 8 hours, 12 hours, there is no 24 hours or post-on-call shift. The shifting by itself, it takes a toll. And so these 2 points you should not be blinded for. And it affects the social life and the life outside the hospital in a different way, more than any other field. Yes, the on-call field different than 9 to 5, but the shift is another toll, another life by itself. Yes, the 50-50 is out of calculation, because the balance by itself, it's an abstract that you cannot even measure. And a lot of theories, the things that you cannot measure, you cannot achieve. It's not that you cannot achieve balance. The balance is totally internal feeling, is what you feel in each moment. And you will be off balance, definitely, because you're not feeling great all the time. And so it depends a lot on what you want, and to have an honest picture of what your life, what do you want from life? What do you want your daily routine to be? Is the routine important or not? Because an emergency, keeping a routine is challenging by itself, in the house, or in social life, or sometime just learning other skill other than medicine. And so big part of it is what exactly you want. It's all internal, I would say. A lot of it internal. Tips is as Dr. Layla said, a lot of it is awareness, expecting that you will be out of balance, and so you will not be hard on yourself. You will be receptive and to adjust, but balancing by itself is all comes from you. So go back to your goals. Thank you.
Thank you, Dr. Baian. I think another question is another tip. Okay, so I'll share this tip with you. This is something I've learned some times ago, is if it's not written, it will not happen, okay? And Let me try this here. Share screen. Continue. Okay, so don't try and read details, okay? So this is a little bit personal, but I am sharing with you my calendar, okay? I know it looks scary, it looks busy, but me and my husband, we decided to share one calendar together. And in that calendar, we added our nanny's schedule, as you can see, the holidays that are in the US, and sometimes off for ourselves, where you can see down here where we said evening off, meaning this is the time off just for me and for him. There are some dentist appointments, there are some things related to our kids, but we share one calendar for both of us together. And the reason why we do this is because we felt that if we didn't do this, we will not give each other the time or the space that's needed, right? So your partner, for the ones that do have partners, will feel that all the time you're working, but when you actually look at the calendar, there are times in between where both of you are not working and you can spend that time with each other or with your family. So I highly suggest having a calendar like this where you put in time for work, have a different color for it. That's your shift. It's in blue, for example. Time for your family time, so every weekend, if you have that privilege, put it in a different color like yellow, and then something in between for yourself. Okay, this is my spa time, this is my exercise time, this is the time for me, I don't know, to have a cup of coffee, sit outside and read a book, or a cup of tea, sit outside and read the book. You can't take it all the way to the smallest details, because if you did not put these things in your calendar, you will forget about them, you will lose them, and then work will take over your life. So this is one tip. There was another question, where was it? About passion. Okay, so how do I keep my passion going? All right, so this is it's a very tough question. And despite being in this career for many years, there are times where I crave to learn something new or something different. I get so tired of looking at work emails, doing Zoom meetings for email. Not today. This is actually a fun speech. So this is not part of that. But sometimes it gets too much, right? It's like medicine, ER. So what do I do to keep my passion going? I think one of them is we all have specific interests in our career in emergency medicine. Some of us enjoy like the art part of medicine. Some of us like to draw things. Some of us like to teach. Some of us like to study in groups. So use those tiny things and evolve and work on them. For example, I enjoy social media in a way. So I have a public Snapchat account where I give out tips to ordinary people on health. It's not emergency medicine, but I talk about, I don't know, GMO. I talk about the bad salt in your diet. I talk about different kind of non-dairy milk. And so I enjoy that part because then people ask me questions and they make me look and study things that are not related to emergency medicine. For example, today, actually, one of someone who was on Snapchat told me, "Oh, I'm actually going to be there. I'm going to listen to you talking." So it's really nice, it keeps you going. So that's my advice for you is try and find something in a way related to medicine, but not 100% medicine, and enjoy it.
Thank you, Doctor. صراحة, a very valid point. Actually, I'm a student and خلاص graduated student, but I believe that keeping a hobby or a time out of medicine gives you more energy to continue in medicine. So it's actually a very valid point, and some people see it as wasting time on things that will not give them benefit on medicine. So actually it's not, from my perspective.
Yeah, I totally agree with you. we all have, and that's the issue, not all of us, but the majority of us have short-term plan. We all are focusing on my USMLE. We're focusing on my Saudi board, my Arab board, whichever board you decide. We all have that short-term plan. We don't think beyond that what's going to happen. And so we focus all of our energy and all of our time trying to get to this short-term plan, when if you keep doing that, you're going to lose the whole picture. So like I said, there is no 50-50, but give yourself a layout. Go outside a little bit of what you regularly do. Be a little bit different. You know, you come to work, you know, every other colleagues studied, I don't know, first aid of USMLE step 1 preparation. And they're like, oh, look at me, I got to page 250. And you're like, shoot, I'm only at page 80. So I need to work harder than that person, because that person is going to get, you know, they're going to pass their step 1. They're going to go to the US, do a residency there. And I won't be able to do it because I'm not studying. And so that peer pressure affects us too. And really, I think you have to look beyond just your short-term goal. And that's where you will actually have a nice balance at work.
Thank you very much, Dr. Layla. I just want to keep up with the questions that we have. We have 3 questions that are not answered yet. One of them is, can you tell us 3 things honestly that you feel obliterate you from achieving balance? The second question is, can you please talk about a day in the life of Dr. Layla? I'm assuming that's the question. So they can truly visualize how a working mom / wife day is. And thank you. And then the last one is someone's asking for your public Snapchat account. So if you can type that out, if you're okay with it. Okay, so that's the Snapchat account. It's in the chat.
Yeah, so listen, the ones that are going to add me on Snapchat, there is not much emergency medicine there. Okay, there is a lot of me and my kids' nonsense and things that we do, and it's in Arabic mainly. So I feel your family will benefit from it more than I do. Okay, so a day in my life. Okay, this is recorded, so I have to watch myself here. Okay, so we get our schedule 3 months ahead of time from work. Okay, and then we have a day where me and my husband sit down and we map out our 3 months. Okay, we put kids to bed. They all go to bed at 9 p.m. And that's a different story, but they all go to bed at 9 p.m. And then we spend the time from 9 to 11, sometimes to midnight, to plan our 3 months. We have that calendar like I showed you, and it's shared on my phone and his phone, and we write down our shifts. We write down the important events, people's wedding, birthdays, baby shower, blah, blah, blah. It's all in there. And then we make sure that we give ourselves nights out, like once a week or once every 2 weeks, where it's just me and him. And then we live our life almost, you know, according to the calendar. It doesn't always happen. There are hiccups here and there, but that's kind of how we start. So now today, for example, today was my off day, and I knew I had this meeting that was going to happen at noon in the US. So woke up early, did the morning routine with the kids. I have 3 children, with the morning routine. And then yesterday, my daughter wanted the IKEA Swedish meatball. I don't know. ما أدري من وين جات هالفكرة, but she wanted the IKEA Swedish meatball that she had in Khubar long time ago. I'm like, okay, mommy's gonna pull up that recipe. So she told me that yesterday, so I pulled out the recipe yesterday. So this morning, after everyone woke up, got into routine, I cooked earlier than usual because I knew I had this meeting that was gonna happen at noon. So we prepared that food. As soon as I was done cooking, I came up and here I am. My husband knew that I was going to have this meeting today. And so he prepared his afternoon to have the kids away for 2.5 hours so that you guys can hear me talking without children screaming and crying behind me. And then after that, of course, we planned to have lunch together. And then because the weather is beautiful, we're going to go to have some ice cream. And then we'll come back home and we're going to watch Matilda because my daughter likes to watch Matilda. And then we all are in bed by 9. So that's one example of how my days are. Again, it's not perfect. It's not always perfect like this. But I think planning ahead definitely helps. Oh, look at that question. Is it different when your partner is not a physician, or it is all about their personality and how supportive they are? So this question is actually, it's a tough question. I will answer it after I listen to the rest of the panelists, if anyone else wants to answer this question.
تفضلي دكتورة سميرة.
Assalamu alaikum, and thank you so much for the invitation, and it's my pleasure to be with you tonight. And thank you, Dr. Layla, for the nice tips that you gave. And most of what you mentioned, it sounds familiar. I'm a mother of 4, and I've been in emergency medicine for the past 15 years. My husband, he's not a physician. And I think it's all about the personality and how supportive he is. And I think communication is a key. You have always to have good communication with your partner. Just tell him about your plans, your important, what is the schedule of your shifts and what's your plan. And it's similar to Dr. Layla. So I told him tonight that I have the webinar. It will be from 7 to 9 approximately. So he's keeping the kids busy. So you will not hear their sounds in the background. So I think it all depends on the personality and the communication between you both.
شكرا دكتورة. فعلا السؤال مهم، فأي إضافات من الدكاترة الثانيين؟
نضيف على بوينت
دكتورة بشاير. Okay, is there any other questions? Okay.
I think Dr. Layla hasn't answered the question itself. Dr. Sameerah answered it, but Dr. Layla, you're not getting out of this.
I was trying to, trying not to get in trouble. You know, I saw that recording button, and now I have to watch what I'm saying. It is
recording and then re-record.
Okay, so it's one of the things I believe is life and work balance should not always be on the woman. It's not something that me or you ladies have to do all the time. It's not fair. Work and life balance is a concept that even men in your life should think about too. They cannot expect that you excuse them if they work all the time because they have to work. This is what they need to do, and then only give you a small percentage of their, the life aspect. I think this is a shared thing, and it's very hard. Our community was, our tradition and community has changed, yes, in the past few years, but there are still the traditional thoughts is mom or women are the ones that are responsible for the life side and the raising up the kids, and work is a secondary thing, versus men where work is the number one, and then he should expect the wife to take care of the house and the kids. But yeah, it's a concept that both partners needs to understand. They both need to share this together. It doesn't matter if your partner is a physician or not a physician, or not even close to the medical field. It really doesn't matter. It all depends on what his personality is, and if he believes truly in this concept that it has to be shared.
Thank you very much for the answer. Honestly, regardless of what I say, it's going to be taken the wrong way. But let me just stick to, I agree 100% to what you just said. that responsibilities for both work and home should be equal. And I, Fahad Abuguyan, as a male, agree to this.
Thank you so
I'm sorry,
much.
كان الميكروفون off I couldn't talk قبل شوي فطلعت ودخلت ممكن الحين it's clear my voice.
Yes,
I just want to add points to what Dr. Layla said. Being a resident, a mother of two, I have a lot of questions تجيني بتويتر عن having kids during residency كمان. I agree to the point إنه أهم شيء is having a good support from family or partner. If you have good support it's easily done إن شاء الله. ودائما كانوا يسألوني if it's a good point to have kids while studying. أنا my kids are كلهم جبتهم medical student بس I feel إنه
ما شاء الله.
medical student أو resident. كنت دائما أقول إن الواحد if they don't overthink the things عادي يتوكل على ربي if you have a good support system and everything can be done إن شاء الله.
If I may add a comment to that, I think this applies to everyone. But I mean, not having kids, obviously, because I'm not the one who's going to have the child. I won't go through the 9-month process. الله يعيننا وياكم. لكن plans, if you overthink them, if you have a set timeline and you're going to be extremely rigid about it and overthink every step of the way, then you're just going to make life harder on yourself. But if you make your plans flexible and just let things be, then I think it will be easier on you, and you'll still achieve what you want, even if it's delayed a little bit. It applies to all aspects of life. So that's just my 2 cents on that one.
I'm seeing everyone here as a family, so I just have a very small advice for the ones that are on their way to be in a marriage life. الناس اللي راح ترتبط قريب. Be honest with your partner, okay? في أي مرحلة من مراحل الدراسة اللي أنتم فيها الحين، إذا أنت فكرتي إنك راح تدخلين مجال وقتك راح بيكون أغلبه في المستشفى، خليك صريحة مع خطيبك أو مع زوجك وقولي لهم إن هذا الشيء اللي راح يصير، لكن I am willing to work with you and I'm willing to do my best to keep that balance between work and life. أشياء كثيرة إحنا في بدايات حياتنا مثلا إن نتوقع من نفسنا كثير ونقول إحنا راح نسوي لكن when we actually are in it, it doesn't happen and then we disappoint our partners. So be very open and let them know that this is what you're looking for. If you wanted EM, you wanted surgery, you wanted plastic surgery, you wanted family medicine, be very open with them and do not disappoint them.
شكرا دكتورة. أي إضافات ولا can we move to the next topic? دكتورة عبير ودكتورة وجدان العساف حياكم الله. حابين أي إضافات على النقطة السابقة ولا تحبون نبدأ بالتوبيك اللي هو shifts and health effects؟ Okay, attendees, do you have any other questions that we didn't answer during the first topic, or any other topic that you would like us to discuss?
I think we've covered all the questions that they have for the first subject. If anything comes up, you're more than welcome to ask the questions and we'll get to them at the end. Dr. Abeer with Dr. Wejdan, you can go ahead with sharing your experiences about shifts and health effects. If you as attendees have any questions about this, which is preferred since this is directed to you, so it should be based on your questions. So please go ahead and ask any questions you have about this subject in the chat section, directed to all panelists and attendees, so everyone can see the question before our guests answer them. Thank you.
طيب خليني أبدأ أنا وجدان or you want to go first? ولا should I start وجدان? خلاص I'll start. First of all, thank you, Dr. Fahad, for this invite, and thank you for the very nice introduction at the beginning. I'm really honored to be part of this, and it's really pleasing, to be honest, to see that move and that everyone is highlighting these subjects that was not spoken about, let's say, 10 years ago. As an emergency physician, thank you, Dr. Layla, as well for this for the first part of this webinar. So I went to emergency physician because one of the reasons that I chose this specialty is because of shift work. I don't like to wake up in the morning every day. I cannot go into the routine of going to work from 7 to 5 and then going to bed every night and then having the weekend off. Saying that, this could be like, it was overrated, to be honest, especially when you move through life and you get your family and you start to grow, and then you come back from abroad to this culture where you're obligated to meet requirement of your family, your kids, and everything else. So for speaking about shifts, again, I cannot do the regular hours. It has a lot of flexibilities and it has a lot of advantages that I really adore, to be honest. And till today, I'm close to 40s, and I really enjoy it. I cannot work mornings or only evenings or only nights. I like the shift hours. But there is a downside for this, and it does affect our health for sure, and that is proven by studies. It's enjoyable, and I know it's amazing, and I'm sure like a lot of people who went to emergency is enjoying it, but it does have some side effect proven by studies. When I went through like this subject is a bit new to me. I didn't like read it in depth till Dr. Fahad assigned me to it, and it's interesting that people in the US and in Canada, they were looking at the effect of shifts on the general health. Those shift workers, are they suffering? Are they healthy? Are they living a lifelong decent life? And a lot of studies, they looked into the effect of those hours on the body system. And unfortunately, there is, especially among emergency physicians and nurses, the circadian rhythm changes secondary to the rotating shifts, and especially the night shift. And that can affect your health for sure. There was some study which I went through that looked into the sleep disturbances and that contribution to the cardiovascular health. Those who did work in shift hours had higher incidence of high blood pressure and cardiovascular events later on in their life. Some of those who worked in shift hours had GI upsets, the GI diseases like peptic ulcers. They had poor nutritional status. Risk of obesity is more. They developed diabetes more than anyone else, and some sort of cancer, prostate cancer and breast cancer. It's really difficult to link both like the effect of the night shift per se to those diseases, but I think it does have an effect. Working in shift hour with with a lot of obligation actually, sometimes can be overwhelming, and it does cause the sleep disturbance, especially when you're not in a fixed schedule. So for example, we do 4 nights and then I have a day off and then I come back to mornings. Or for example, I do like 7 days or 7 day, like 7 shifts in a row. That is really devastating, and there is a lot of method that I'm personally using to adapt with these inconsistency in the schedule. One of them, I would say, having a fixed sleep hours. For example, like I work either mornings and nights. I have to sleep between, for example, 9 p.m. and 11 every day, or between 10 and 12. Like when I finish a night shift at, for example, 10, I come back, I have to have a nap. Even if I wake up at 1, that's okay. But I have to have a fixed hours of sleep. Beside having, again, as Dr. Layla said, you can have a hobby, or you can have something else other than work. You know, sometimes it is hard because basically there's no time. But if I personally have to have an hour per day for myself. Watch a movie, eat a popcorn, eat a junk food, or like do whatever I want, an hour every day. And even my kids, they respect that hour. There is other method that I use, but I'll just keep them. I'll open the discussion for Dr. Wejdan if she wants to add anything, or for anyone else if they want to ask question, we can just lead. I'm sorry, am I heard?
Yes, Doctor.
Yeah, you're heard. We were just checking for Dr. Wejdan. I think she left. Let me just send her a text and see. She may have disconnected. She may have left.
Okay, so if there's any question, I can answer those from anyone.
I have a question.
Sure.
Because I think these shifts and health effects apply to all, and I have a question / remark. I'm not entirely sure what it is yet, but one of the reasons I chose emergency medicine is for the same reason you guys mentioned earlier, is because I don't like routine. I like shift work. I like to go there for 8 hours and then forget everything behind and live my life until the next shift. I understand the difficulties with shift work. I understand that maybe not now, but maybe closer to the 50s, I may have trouble with shift work. We've seen this in the past. We've seen this with our senior consultants. We've seen this in the senior consultants abroad, where they prefer to work morning shifts only, so on and so forth. One of the reasons I chose my fellowship to be non-clinical is to have something to fall back on. And this is a question directed towards you and Dr. Wejdan, due to your fellowships. So choosing a fellowship that's not entirely clinical, or that doesn't require that you do shift work, intensive shift work, such as in your case, medical education, and Dr. Wejdan's case, disaster, so she can be the head of Al-Hilal Ahmar at some point, which requires her to do basically a routine daily job at some point in the future when she's sick of shifts. That's the reason why I chose medical administration. Is this one of the options, let's say, that's open to all in terms of determining what they want in their late career in terms of how to choose a fellowship or not?
That is completely true. And I think it's a bit unfortunate that we're thinking in that way. Like you were trained in Canada, and I'm sure you met people who's in their 60s and close to 70s who usually work, like they work in emergency, and they do shift hours and they are enjoying it. I met a lot of people there, but like again, this is completely true. When I did my fellowship, I did the trauma fellowship, and I said, well, I'm not going to work. I'm not going to do this for more than the 50 years of my life. I if I reach to the 50s, I want to do something very comforting. I don't want to work night shift, and you can even see that in our population, in our community, emergency community. How many of those who's working like complete schedule above their 50s? You can just count them on your hand. I don't think there is a lot, and I believe because the culture does not support the fact that you're I mean, like, we don't respect the schedule. We don't have the flexibility of doing, for example, minimal nights or minimal hours. In my institution, we're doing a baseline of 15 to 16 shifts if you don't have any assignment, which is a lot. And R4 is doing less than that. And then I think that is where we're heading in the Saudi community, that even emergency physician in other institute, they're looking into the number of hours. People who's working nights is not differentiated from people who's working afternoon or mornings. So there is a lot of things that keep us away from continuing in this career as an pure emergency physician. If you look at the big picture as well, the health system is not equipped with a proper follow-ups for the patient. So if you want to see a doctor within the next hour, where would you go? If you need to see a doctor for whatever reason, the easiest way is to go to emergency, which is not the right thing to do. And that is causing on overcrowding, and that causes a lot of problems. And then as an emergency physician, you're obligated to work in an environment which is with certain like KPIs and certain standards that you want to meet. Again, I totally agree with you. Like, I am one of those people who did the fellowship because I want to pursue my career in education later on. I like shift works. I do enjoy it, but I'm not going to do it for life. Hanan Alzeer has a comment, so you can just go ahead, Hanan.
السلام عليكم.
عليكم السلام.
سامعيني؟
نسمعك.
Okay. Thank you, Dr. Fahad, for the invitation. I'm really honored to be with this group of super women. Actually, I consider them, most of them are my friends and colleagues. I would like to comment about the shifts, especially that the night shifts, especially that I'm doing only night shifts for more than a year now. In the beginning, like any other colleague mentioned, it was appealing to work, to do shifts because of the flexibility and the like the convenience of night shifts for most of us. But now, after like more than a year doing only night shifts, I would like to tell you that I want to do morning shifts again. Because the impact that I see now on my health, on my biological clock, on my circadian rhythm is really difficult to fix. Even in my off days, I'm struggling to reset my sleeping cycle again, despite using sleeping aids like melatonin. Sometimes it doesn't work, honestly. Exercise, doing yoga sometimes, and meditation. All of this, unfortunately, had failed at some point to reset my sleeping cycle again. The other thing that I would like to add, with increasing responsibilities now, family responsibilities for me, I can tell that night shifts are impacting my commitments with my family and my social commitments in a way or another. The impact of doing night shifts for a long time cannot be denied. I know some people can prefer it. I used to prefer it until now, because of too many factors. Usually the night shifts are more quiet, avoiding the road congestions and traffic in the morning, which adds stress. So that's why I used to avoid the morning shifts. That's one of the reasons. The chaos that happens in the morning because of the rounds that happens in the emergency, the number of unnecessary visits in the morning, sometimes a lot of consultations from clinics, or a referral from some services like the endoscopy unit, for example, to emergency. This add loads usually in the morning shifts, and caused me to avoid it at some point. But now I can tell that night shifts has a significant negative impact on my life.
Thank you very much, Dr. Hanan. Go ahead.
Oh, sorry. كنت بقول إنه I totally agree with Dr. Hanan, but working night shift only is better than doing like the chaos that we're doing in other schedules. For example, doing nights, but then going back to mornings, but then afternoon, but then going back again to morning, but then nights. It's fixed schedule is better than the chaos that we're doing in some institution. Let's go ahead, Dr.
I agree. I just wanted to comment the same actual comment on the night shifts. If you do all nights, it's definitely better than the mix. But if you're going to do the typical mix of mornings, evenings, and nights, then what I typically do is I basically request my shifts in advance. So I say that I want, let's say, if you're going to put me nights and I'm supposed to be assigned a third of my shifts that are going to be nights, I'd like to have them back to back. It's different from institution to another depending on how many shifts total you're required, and basically, so it means how many night shifts you're required to do. So it makes a huge difference for me if I'm only required to do 3 nights or 4 nights a month, which is not the case for Malik Khalid Al-Jami. Then I actually request them to be all back to back, get them out of the way, fix my sleeping pattern the day after by sleeping a couple of hours after the last night shift, 2 to 3 hours in the morning. You wake up a little groggy, you're a little bit tired, but then you fix your sleep the same night because you go to bed early. And that's just my method with it. Dr. Baian, you have a comment, go ahead.
Hala, yeah, I agree for most of what you said, guys. I just want to emphasize the aging effect on our ability to do the shifts. Students now, if you think the shift is no problem, that might not be true for the rest of your career. And so just have an area in your mind that you might not be 100% definitely sure that you're able to go with the same speed for the shift. That's one thing. Number two, the thing that Dr. Hanan said, that the more responsibility for family, the shift might affect them. I find this true now. I'm a mother of two teenagers, and yes, the balance of life work is different, and it requires more skill and flexibility to achieve it. But it goes beyond that, because sometimes you pass along the chaos in the schedule for the kids or for the parent if you're taking care of them, because of the contact that you need to do. And then there is one more point that I want to add. The health effect of emergency. I think there is 2 points, not just the shifting per se, but because it is very special work, your epinephrine in the shift, the things that the variety that you have, the acuity that you have is also would affect or would have health effect. It's different than let's say if you're a security and you're doing shift, with low acuity shift, but this is high acuity. And so the health effect, I advise you guys to really read about it. It's all over there is a lot of studies about this. And pregnancy, and even in some studies, even they studied the divorce rate, that it's different in people who's doing shift. The premature delivery in the pregnancy, other than some difficulties with psychological or mental, even cardiovascular. So it's not something you take lightly. So that's the points. Yeah, thank you.
Thank you very much. Sorry دكتورة وجدان، ترى ما كنت موجودة باللستة وفكرتك طلعتي الآن رجعتي باللستة. You can go ahead and share your experiences and thoughts on the topic.
طيب، يعطيك العافية دكتور فهد. هل صوتي واضح للجميع؟
واضح، الله يعطيك العافية.
الله يعافيك. أنا بتكلم بالعربي أحس يعني في أريحية. إذا في أحد من any of the attendees is only English speaking, just inform me to switch. أنا بتكلم عن العموم وبتكلم عن تجربتي الشخصية. To be honest، يعني الواحد يوصل البالانس أحياناً بعد وقت. مستحيل يجي البالانس والواحد R1 R2. أحياناً حتى يحتاج الواحد يخلص البرنامج ويبدأ حياته كاستشاري، وبعدها you will reach this balance. لا أحد يحكم على وقت الريزيدنسي. وقت الريزيدنسي it's a hectic time. You have many shifts, you have to read, you have to present, etc. يعني if you survive residency you are a hero. بعدها الحياة ترى تبدأ تصير أجمل وألطف وتكون يعني تحت تحكمك أنت. المرحلة اللي بعد الريزيدنسي مرحلة إذا صرت استشارية، خلصت الفيلوشيب، started your life, you had your kids. بعدها يعني في هذه المرحلة خلاص it's okay إنه الواحد تكون البرايورتيز حقات الشخص تختلف من فترة لفترة. في وقت تقولين أنا my priority is to finish residency, I don't want to have family, I don't want to have kids. بعدين ممكن تقولين أحياناً الواحد يبدأ حياته من بدري. أيما كانت أولوياتك دايم راجعيها. الطوارئ ممكن الناس الآخرين يقولون لك that it's difficult, how can you do it, it's not compatible, etc. لكن إذا شفنا يعني الجانب الثاني، الطوارئ في ميزة الفريدم. يعني إذا تم تحديد عدد الشفتات بشيء reasonable you will enjoy it. من تجربتي أنا الشخصية، أنا أم لطفلين. طفلي الأول جبته أنا pure consultant, pure clinician. I have nothing to do other than my shift work. كنت معاه في كل المايلستونز حقاته، يعني حتى أكرمكم الله، يعني آسفة to be frank، بس حتى يعني الدايبر تايم حقه أنا كنت أعرفته. صح كان في أيام صعبة، الأيام اللي يطلع فيها نايت إذا كان هو تعبان، لكن هذا بيجيبنا لموضوع ثاني بتكلم عنه بعد ما أخلص. بنتي جبتها وأنا full academic staff, limited number of shifts، لكن كان لازم أروح دوام شبه يومي. راحة الدوام اليومية جزء كبير من الناس، يعني سبحان الله زيها زي الشفتات، مو كل الناس يتحملون الشفتات، والدوام اليومي هذا اليوم كامل أو شبه اليوم كامل مو كل الناس يتحملونه. أنا انبسطت مع ابني وعرفت المايلستونز حقاته أكثر من انبساطي مع بنتي ومعرفتي للمايلستونز حقاتها. and to be honest رجعت مرة ثانية للي ولحياة الشفت. الشيء اللي مثلا يجعلك مبسوطة، يجعلك سعيدة، يمشي مع حياتك، يمكن ما يكون اللي عند الثانيين، وبالمقابل الأشياء اللي تبسط الثانيين وتخليهم يعني they reach the balance ممكن ما تكون عندك. to reach the balance أول شيء لازم نعرف إيش اللي نبغى في الحياة. what's my priority. رقم 2 نخلق وقت للشيء اللي حنا نبغاه. يعني ممكن يقول الواحد خلاص أنا ما أبغى أشتغل بارت تايم، أنا بشتغل بس الشفتات حقاتي. أنا ما راح أتكلم عن مرحلة الريزيدنسي. مرحلة الريزيدنسي هذا شيء مؤقت وبينتهي بإذن الله، وكلكم بتصيرون استشاريين. وحتى الانترنز لو كان معنا انترنز، مرحلة التدريب هذه بتعد. الواحد يشوف نفسه بعد 5 إلى 10 سنوات. فset your priorities، راجعيها كل فترة والثانية. create time for yourself. لازم نستعين بمساعدة اللي حولنا. يعني مثلا أنت في منطقة في أهلك وأهلك بصحة وعافية وتقدرين إنك يساعدونك تخلين أولادك عندهم فيها فترات معينة، ليش لا؟ أنت الحمد لله يعني من ميزات العمل الطبي يعني الدخل المادي جيد، جيبي كذا ناني. الأطفال بيكبرون، الأطفال يحتاجونك بشدة لفترة، وبعدها بإذن الله بيكون لهم حياتهم المستقلة، يكون دورك أنت التوجيه لهم. هذا للعموم. بالنسبة للشيفت and health effects أنا ما راح أتكلم عنه، في studies كثيرة عنه، لكن إذا الواحد رتب نفسه، رتب الجدول بطريقة معينة إنه يقدر ياخذ فيها كفايته من النوم، مثلا ما أخذ أكثر من 3-4 نايتس الرو، الأفترنون أحاول أقسمها، كله يرجع للتفاهم بينك وبين الشخص اللي يسوي الجدول. ويوجوالي يعني حنا يلي في الطوارئ الحمد لله كلنا فريندلي مع بعض. يعني أنت هذا الشهر تبغين تضغطين نفسك في أسبوع أو أسبوعين، تكلمين اللي يسوي الجدول، تبغين تاخذين الأريحية وتقولين البريفرنس، وما راح يعرف الواحد البريفرنس حقه لما يجرب طريقة مختلفة للجداول. في بعض الزميلات ينبسطون تماما على شفت الليل، يعني بغض النظر عن الهيلث افكت، لأنه شفت الليل هذا وقت نوم الأطفال، بعدين يصحون الأطفال بعد ما ترجع يروحون مدارسهم يمديها تنام. فهذا اللي عندي. إذا عندكم أي أسئلة I'm more than willing to answer you.
في سؤال على الشات. شكرا لكم جميعا. صراحة يعني في أشياء يعني نورتوني عليها كثير. في سؤال للدكتورة عبير والدكتورة وجدان أولا، بما أنهم ليدنج التوبيك هذا، أو بعدها نفتح المجال للأذر بانلست إذا عندهم إضافات. السؤال يقول shifts and sleeping disturbances, have these ever affected your work؟ يعني أنا أتوقع الكويستشن حسب ما فهمته أنا، وممكن تصححنا صاحبة السؤال، has shift work ever affected the quality of patient care basically؟
الصراحة عني أنا مثلا أنا اكتشفت إنه أنا كشخص أكثر من 3 نايت شيفتس ورا بعض تأثر علي، يعني تركيزي يكون أضعف، قدرتي على العطاء. فصرت ما آخذ 3 ورا بعض، أحاول أرتب أموري. وحتى مثلا في الفترات اللي أنا أحتاج أسوي فيها بارت تايم أحاول أتجنب النايت أو أرتبها بطريقة معينة. شفتات العصر ما لاحظت فيها أي شيء. أحيانا، وبتلاحظون أنتم على نفسكم، ترى ال ER work is very hectic. يعني حتى شفتات الصباح صح أنت تروحين مع normal working hours, but you see way more patients that anyone will see in clinics, etc. Short answer, كل واحد له قدرة تحمل عدد معين من الشفتات ورا بعض بطريقة معينة. ف test yourself and see what's good for.
دكتورة عبير، عندك أي إضافة للسؤال؟
Yeah, no, I totally agree. يعني with the same concept. Yes, it does affect صراحة يعني. The sleeping disturbance does affect my quality of work. وagain زي ما قالت الدكتورة وجدان, it's a personal preference. في ناس تقدر تسوي, يعني تقدر مثلا تشتغل 3 nights بعدين 2 off بعدين 3 nights again, أو again it depends on you. بس أنا my يعني personally إذا سويت إذا if I shifted from nights to morning, or I did not have a good sleep, and usually I don't get a good sleep that night before the morning, the decision-making process يكون clearly impaired. I have to overthink عشان I don't want to miss anything. I'm extra cautious, يعني المود شوية يكون on the lower side. حتى لو يعني أخذت يعني if I had some stimulant زي قهوة, يعني بس قهوة. ما يعني I think it does. يعني no one can deny the effect of sleep disturbances on the work, and I think it's amplified in the emergency medicine, to be honest. The answer is yes. بس again يعني إذا كان في flexibility or the luxury of choosing the shifts, هذه كلها will help out easing your life and you can manage your life. This is the beauty of emergency. بس للأسف إنه this luxury is not available in most of or يعني some of the institution. We struggle sometimes on coverage, on number of shifts and overtime sometimes, just to be يعني a team worker and stuff.
I agree with all the points mentioned. I think it's very important to test yourself out and see what you can tolerate and what you can't tolerate. And then if you're in a place that gives you the option of actually sorting out your shifts to what works best for you, then great. If not, then find that place. That's my short answer to that. There's another question that says, دكتورة كيف تقبل أطفالك لغيابك أو نمط الدوام اللي ما له روتين واضح منتظم بالغالب? This question is for both of you and for other panelists once you guys answer.
I would like to answer that question, if that's okay.
Go ahead.
Okay, so with kids, they don't get the idea that you are having specific shifts or specific hours. To them, you're either here or you're not here. So to make it easy with your children, the best rule of thumb that I've done, and I think it works, is that when you are there, you should be always there. يعني احنا نغلط غلطة كبيرة لما نرجع من الدوام ويكون وراي غسيل، وراي طبخ، وراي أكلم فلان وما أدري، وننسى أن الأطفال كانوا بعيدين عنا طول الفترة اللي أنا كنت فيها في الدوام، فهم يتوقعون الحين ماما رجعت, it's my time with her. So you have to separate everything and give them all the time that they need from you. الحين إذا الواحد قال طيب أنا الحين شفتي متأخر أرجع الدوام وهو وقت نوم الأطفال. إذا كان مثلا أطفالكم ينامون الساعة 11 بالليل ينامون 9 بالليل وأنتم المفروض توصلون 10, اطلبوا من اللي كانوا يراقبون الأطفال خلوهم يتأخرون شوي ساعة, بس أجي عندهم أقرأ لهم قصة قبل النوم ويروحون ينامون. So do your best to give them as much time as you can. And when you are there, be there for them. You're not on your phone, you're not on the TV. There are, يعني, ترى إحنا نحط pressure كثير على نفسنا نحن موظفات، لذلك إحنا نحاول أكثر من غيرنا نحن نعوض الوقت مع أطفالنا. في مثلا أمهات شغلهم أقل أو there is no demand or they stay home all the time and they don't give the attention to their kids because they're there all the time. So don't feel like you're the only one that's not doing a good job because you are working. In fact, you're probably spending more time with your kids than the other women from different careers are doing because you have that guilt, you have that feeling that I don't think I'm spending enough time, so you're trying your best. So that's my rule of thumb is when you are at home, give it 100% for your kids.
يمكن if you allow me some of the tips that I do with my kids, that I speak to them, I tell them, يعني they usually ask me, they used to ask me, Mommy, are you going to stay home or when are you going to work? I'm just being honest. And they tell me, when are you going, when are you leaving, and what time are you coming back? So in morning shift بالعادة يعني I make sure إنه the night before I tell them ترى أنا بكرة الصباح، لأنه خاصة الحين أيام الإجازة مثلا إنه I tell them I will be at work when you wake up, but inshallah I will see you in the afternoon around like 3:30 or 4 p.m. and then we will I will create some time to spend with them, at least 2 hours. We will just sit together and do something, a sort of activity together. In the evening يمكن هو أنسب shift. We will wake up together, we will have breakfast, we will spend some time before I go to work. بالنسبة للنايت شيفت يمكن وخاصة لأطفالي الصغار يعني I make sure to put them in bed. I tell them that I will be going to work and inshallah I will come back either when you wake up or maybe before. So just talk to them, explain to them. إحنا نعتقد إنه الأطفال يمكن يعني وخاصة إذا كانوا صغار في السن تعتقد إنه ما يفهم، ما راح يميز إذا أنا موجودة أو ماني موجودة. They're very smart and يعني مرة مهم إنه to give them the sense of security and safety. You have to tell them لأنه إذا صحوا الصباح ما حصلوا their parents at home, it will be scary to them. يعني هم وين راحوا؟ فمرة مهم إنه تتكلمون معاهم وتقولون لهم ترى إحنا رايحين الشغل إن شاء الله، ويشوفونكم حتى وأنتم طالعين من البيت, and then so they will know that you're coming back at one point, so they will see you and greet you whenever you arrive home.
Excellent points. Thank you very much. Do any of the other panelists have anything to add, or should I move on to the next question? I guess that's a no. Okay, so the next question is, and I think this is an important question, with all that work and stress, how can you maintain your mental health? Dr. Abeer, Dr. Wejdan, any of the other panelists, you're more than welcome to jump in and answer.
I totally agree, and this is a really very important question, or it's underrated, underlooked صراحة in our community. But you have to take care of yourself. Again, being aware that you're under a huge amount of stress, or knowing that you're going to break down soon. أول شيء I believe awareness. يعني you have to take care of yourself. If you did not take care of yourself, no one will take care of you. You are the one who should advocate for yourself. Second, prioritize your life. So يعني sometimes work can take your life away, and you can easily get soaked in that culture and in that environment. But again, يعني it's make it a habit always to stop and go back a bit and look at your life from different perspective. And زي ما قالت دكتورة وجدان يعني prioritize yourself and put your goals, and then go back and visit those goals and priorities every now and then. We cannot deny that we have bad days. يعني I'm speaking about myself. About myself, I do have bad days. I become moody, and sometimes I have like depression, and I can't. Sometimes I really need to run away. But I found that in another قبل الكوفيد I finish 6 weeks of working, and then I take at least a week off, either from my annual leave or like I requested as off days. So I don't work any more than 6 weeks in a row. And then I have to schedule some time off away from work. And then I either spend it with my family or my kids, or I can just travel. هذا كان قبل الكوفيد. Maybe يعني the COVID has a huge impact on our mental health as well, and it would be interesting if someone can look at that. But يعني in regular, if إن شاء الله إذا رجع كل شيء يعني زي ما كان من أول, I believe prioritizing your health, your mental wellness, your physical wellness, your family, your kids, your hobbies, yourself, and your work. You can achieve a lot, and you can be more productive if you're healthy. You cannot just go and go on with the bad habits and expect it like a good outcome at the end. دكتورة وجدان إذا عندك أي إضافة.
دكتورة عبير.
أيوة
حابة بس أعلق على الموضوع بخصوص ال effect of doing shifts on mental health. As you mentioned, I think most of us have experienced like days of low mood and lack of interest and what looks like depression. It's not like a clinical depression, but maybe days of low mood. What I have experienced actually was after doing 2 night shifts in a row, especially in our hospital, we are doing 12 hours, not 8 hours. So it's really draining. So the next day will be just sleeping, trying to rest. The day after that, I feel like I'm just in a low mood and like I don't want to do anything. I'm just like, I just want to stay at home, but I try to resist that because I don't want to get absorbed into that feeling and get consumed by it. So I force myself to go out of home, not for a specific place or just roaming around with the car, grabbing a cup of coffee, just to break the cycle and not to get absorbed into that low mood and that depression. So this is what I do usually, or maybe going to the gym, trying to exercise, like a light exercise, not necessarily a very strong one. So these are a few tips of what I do to overcome the mental health issues with the shifts.
I think it's important to recognize what you really like and what you will get you out of this mood. Different people, they have different ways to do things to distract themselves or to change their mood. لكن I think يعني أهم نقطة إنه يعني لازم تسوون أشياء تحبونها، سواء هوايات، تحبون تسوون رياضة, you like to go to the gym, socializing, go and see or talk to someone, talk to your friends, سواء كانوا from the medical field, so you can really vent to them, or from, sometimes it's يعني beneficial to have friends خارج الوسط. They're not physicians, they do not work in hospitals, so you will have or you will be talking about different topics ما لها علاقة بالشغل ولا لها علاقة بالأشياء اللي مضايقتك يعني, and you will see the huge difference when you go with your friends and talk about something or do things that you really like. You can watch TV, watch what يعني the things that you like, either watching documentaries, movies, or Netflix, whatever يعني you like to do. ويمكن هذه بعض الأشياء, وحتى spending times, sometimes good times with the people you like or you love, سواء friends or family. يعني it really makes a huge difference.
Thank you very much. I think that these are important things to focus on. I agree with all that's been said. I think this also goes back to what Dr. Layla said and what Dr. Bayan said in the beginning. And even Dr. Wejdan. This comes in part with achieving the balance and finding the sweet spot. Along with this comes avoiding the things that you know will lead to you being overstressed and not having, let's say, 100% mental health at the time. So I know for a fact, especially with the 12-hour shifts that are ongoing now, which will end, inshallah, by the end of this month, we'll go back to 8 hours. I know that I can't do 2 night shifts in a row, simple and plain. So I spread out my shifts. I don't want to. I don't want to do 2 nights in a row. I don't want to do 3 12-hour shifts in a row, regardless of whether they're nights or days. So I avoid these because it goes back to, one, it's going to affect my mental health because I'll be in a low mood. It may affect my decision-making process while on shift. The quality of teaching, which is typically when it's a busy shift, it's not that much, goes down as well because I'm not in the mood to teach. Some of the residents who are with us now who have worked with me know this. It depends if it's the first shift of a lineup of shifts or if it's the last shift. So I try to avoid these things because, one, my mental health comes first, and two, I care about teaching the residents, and three, I want to care for the patients at the best of my ability. Things that we don't do typically as because it's our culture, يعني في السعودية, is we don't plan things well in advance. If you like to travel, plan them well in advance. Plan your vacations in advance. Space them out. Take a week off, go somewhere you like, enjoy yourself, turn your phone off, come back, enjoy it. So planning ahead does help a lot. Another thing that I would like to comment on as well that helps with this is if you're offered extra work and at that time you feel that you have enough work on your plate, it's okay to say no. It's okay to politely say no. I discovered no towards the end of my fellowship. When, since the beginning of my fellowship, I was just given tasks after tasks after tasks, and I just gathered them all, and it got to a point where I just had to say no. And once I discovered no, I mean, it's priceless. It helps a lot. Once you say no to something, knowing that you can't do it to the best of your ability, that also helps with reducing the unnecessary stress in your life. So that's just one of the comments that I wanted to add. Thank you.
I'm learning a lot from everyone, so thank you so much for your tips. I just wanted to share, so I'm an editor on ALIUM, which is Academic Life in Emergency Medicine. We have a wellness think tank. We've been running this for now 3 years, and it's free of access. You can go in, and there are multiple podcasts that are all related to wellness and mental health, especially for EM physicians. Since I cannot share my links here, I'll just type the name of the website, and all the podcasts are on SoundCloud.
Great, thank you very much. Dr. Rawan, go ahead, comment while I go to the next questions. Yeah, the next question is, can you please share your experience with maternity leaves, especially doctors who had their first child during residency? Did that delay or hinder your progress?
I had my first child when I was R3. And, you know, as the regulation of the Saudi Commission, you cannot take more than, you can just plan it ahead and take some off time and drop up to 3 months maximum. And sometimes that include even the annual leave. So I had my child during that time. To be honest, it was challenging, but I had a very supportive family. I had a nanny, and they were doing a lot with me. It did not stop my progression. Alhamdulillah, I passed. It wasn't. There is a new obligation. It's a new thing in your life, and it's not easy at all to do it. But again, you have to look for support. Again, as Dr. Wejdan said, you have a circle of support, use them. Again, residency is just a temporarily a period in your life. You have to pass it and then do whatever it takes just to prioritize your stuff in your life and try to give everyone their share, but in the same time, just keep that balance. I didn't have any specific صراحة tips for you. It was hard. I can't say otherwise. It was hard, but with the help of people, alhamdulillah, it wasn't an obstacle.
Thank you very much. I believe Dr. Rawan had a comment. Do you still have a comment? You can go ahead.
Assalamu alaikum. طبعا I'm just 8 months in my residency. I don't know if my comments is gonna help you a lot, but during our med school internship, we are dealing with the stress. It's become like our daily habits. But I'm just gonna tell you, like, don't let the work life steal you from your friend, your family. Don't grow out farther from them. Keep in touch with them, because residency, internship, middle school is temporary in your life. It's gonna pass. Just deal with the stress. Don't overwhelm yourself. Think out, plan out your action. It's gonna pass. Just this advice, and thank you for all the speaker. I learned a lot actually.
Thank you very much. If no more questions on this subject, we can move on to the next subject. Thank you all for the amazing comments and for the good questions as well from the attendees.
Is there any more questions before we start talking about gender bias? Okay, Dr. Hanan, you can start.
السلام عليكم. صوتي واضح؟
واضح، تفضلي دكتورة.
Okay. I would like to thank again Dr. Fahad for inviting me to this webinar. Talking about gender bias, يعني أتوقع إنه يعني the topic is really convenient for me because I was the first female to join emergency medicine board certified to join the department in King Khalid Hospital. So I've spent like a year or two where I was the only female there. Gender bias, what is the definition of gender bias first? It refers to a person receiving different treatment based on their real or perceived gender identity. So do we have gender bias in emergency medicine? Yes, of course we have, like any other medical specialty. لو سألنا يعني في ماذا يتمثل الجندر bias, or what are the pictures of gender bias? Gender bias can range from a frank sexual harassment to subtle comments or actions or different treatment from colleagues or from bosses in the department. another aspect of gender bias, not only how you get treated by your co-workers or colleagues, but also the society, the patients themselves, their relatives, the other departments. How do they treat you as a female physician, especially in emergency? طبعا يعني من التجارب اللي أنا مريت فيها، خصوصا أول ما انضميت ل قسم الطوارئ في مستشفى الملك خالد الجامعي، كان مثلا comments من بعض البيشنتس لما أجي أفحصهم أو بعد ما أفحصهم وأخلص يقول لك نبغى دكتور. This is very common. I think also my colleagues have experienced the same thing. Other pictures also of this. يعني أول اسمحوا لي يعني أستخدم أو أستشهد بأحداث صارت لي. إنه في مرة من المرات مثلا كنت أحاول أسوي shoulder reduction. Patient was obese and he was a huge patient actually. So I was hearing like whispering from the interns and students with me that she won't be able to do it because the patient is big, and it was successful and it was really easy. فهذه يعني مظاهر من الجندر بايز اللي ممكن تشوفونها. طبعا لما بدأت بعد ما خلصت البورد وبدأت كتيم ليدر أو assistant consultant في الجامعي، وكنت the first female there. I faced a lot of resistance from other colleagues to take orders from me because I was a female team leader. يعني لاحظت كثير أقول أشياء ما كانت تتسوى. في ناس يعني كان واضح على وجههم يعني مو متقبلين الوضع هذا، إنه female تكون هي team leader وهي اللي تعطيهم orders. So there was resistance. I was getting upset in the beginning. And with time, I was able to overcome this by proving that I'm up to the responsibilities that I was given. And there is no difference between me or any other male colleague. الفيمale physicians عددهم even I'm talking about something worldwide from an ASAP article. We are only 27% of emergency physicians. So 27% of emergency physicians are female. It is, I think, expected to have gender bias in emergency medicine. Gender bias doesn't reflect only on practice. It reflects also, unfortunately, on training. There was an article about training in emergency found that women, they receive feedback different from their colleagues, male colleagues, or from men, because women are constantly receiving a feedback about assertiveness and confidence, while their male colleagues, they received feedback to improve clinical skills, and that was proved by studies. There was another study found that women and men entered emergency medicine training with similar skill sets. By the end of the residency, men achieved training milestones at a higher rate than women. The achievement gap was measured as equivalent to a full 3 or 4, even 4 months of training. So this is a significant change or discrepancy between the two groups. So what makes this gender bias exist? I think like any other specialty, but it is maybe more evident in emergency medicine because it's a young specialty if you compare it to other specialties like medicine or surgery. That's why the impact of gender bias is still obvious in emergency, not overcome yet like other specialties. That the whole culture is built around males mainly. Even the in other hospitals, for example, the lockers room will be mostly for males. And if a female walked into it, she will feel like a complete stranger. She will not feel comfortable. In other hospitals, I think it's still we have this. The lounge, the doctor's lounge or doctor's room are dominated by males. You will rarely find a hospital that has a specific room for females because they are a minority. There is another picture also of gender bias where some male doctors doesn't feel comfortable working with females, and they will be avoidant with lack of eye contact, for example, with also the conversations will be rigid, and it will not be the same conversation that he will have with a male colleague. Some male colleagues, you will feel them that they are not comfortable talking to a female physician. Also, there is another picture of gender bias and emergency, which are making jokes about women's clinical judgment being clouded by feelings and emotions. This part is really important to me because some people, they might see it as something negative or downside of being a female. But actually, I see it as power because care is all what the patient need and want, rather than only rigid decisions. If some people tell you that you are emotional or your decision was based on feeling, don't be ashamed of it. Don't feel guilty for implementing your emotions and making decisions as long as it is into the patient favor. So, there is another also picture of gender bias in academia. That there was studies in gender gaps in academic medicine that showed that bias in the workspace is often cited as a limiting factor for career advancement. So this is also one of the aspects. So the gender bias can take many shapes. It is there, and unfortunately, sometimes it is really subtle that no one will recognize it, not the males, neither the females. It will just pass unrecognized because of the lack of the awareness. So if it is there, and it will continue to be there until only God knows, what can we do toward gender bias? There was suggested solutions and actions to deal with gender bias in emergency that was mentioned by ASIP in one of their articles. The first action was to implement bias intervention training and discussion. You have to address the elephant in the room. Things shouldn't pass like that, because if you just let them pass without being recognized and addressed, we will stay in a vicious cycle. It will never end. The attendings can actually incorporate their own awareness of gender bias to reduce the impact on residence evaluations, for example. So if the attendings aware about the gender bias, they have to consider it every time they evaluate a female resident. So they will be aware not to fall into the trap of this bias. The other thing is that residency programs should incorporate data-driven bias education into their lectures and grand rounds to improve the awareness about the situation. The other solution that is suggested is increase the ratio of women faculty members and create a mentorship programs for female residents. Actually, they found that lack of mentorship constitutes a significant barrier for many women to who wish to pursue an academic career in emergency. And seeing women in positions of leadership will inspire other women and help create an environment that will support female physicians and trainees. The third solution that is mentioned is to promote and support research on gender in medicine. So as we said, we have to address the elephant in the room in order to deal with it. So doing research on the manifestation and the impact of gender bias in our field must be encouraged. And there is actually platforms that publish specifically about women in emergency. I will just link it. I'll give you the link in the discussion. It is called the Feminim, okay? The Feminim is a website, and they have also events. It is full of articles that talk about the gender bias, the women in leadership in the emergency medicine, and also everything that, also maternity, everything that that can benefit women in emergency. So just in conclusion, being a woman in emergency is not something easy. You will face obstacles, resistance, and you will just overcome them with time, and by proving that you are really up to the responsibility that you are given, and by setting your boundaries. It is important, really, ladies, to set your boundaries, not allow anyone to step on these boundaries under the name of their position or their power. I think, and be proud of implementing your feelings in the decision, because if it's in the patient's favor, don't care about any other opinion. You are saving life, you are providing care, so this is what the patient need, other than knowledge and standardized judgment. Any question?
Thank you very much, Dr. Hanan. You've enlightened me to a lot of things, actually. I remember during residency, a few of my female colleagues in the same year were telling me, or us as a group, as a part of their stories, that every time they enter a patient's room, they automatically assume that she's a nurse, and after she's done her assessment, they ask her when the doctor is coming. Yeah. And this is something that happens on a daily basis. So it exists, it definitely exists in medicine in general, and definitely in emergency medicine. I think it's an important topic to talk about. And one of the things that we read about all the time nowadays is the gender pay gaps. So it's been brought up multiple times in different specialties, not in medicine on its own, but medicine is definitely included, that if a male and female applicant come to the same job, the salary offered to the male candidates is typically higher than the female counterpart. I still to this day don't understand why, to be honest, because
do you have this in Saudi Arabia?
I don't think so, because the pay is
standardized mostly.
It's standardized by MOH for everyone.
Maybe positions. I believe that positions and advancement in career is different here in our country. It's really obvious, but regarding the salary, I think in the governmental hospitals, it follows a standard, so there will not be
which makes sense to me, because it's a job, so whoever gets that job gets the same pay. But I've read articles about gender pay gaps in the US and Canada about female applicants to the job will get a lower offer than the male applicants, which never made sense to me. It's not an issue here in terms of pay, but it's definitely an issue for career advancement. Now, this is specifically true for emergency medicine, because we've definitely had, we have, I think still, not I think, I know for sure, we still have, let's say, less female attendings, less female faculty in universities and schools in emergency medicine compared to male, which definitely plays a huge role into female career advancement in the specialty. Now with accepting more females into the program, I think our program is almost 50-50, if I'm not mistaken, maybe 60-40, if I'm being generous. I don't know. I think it's 50-50 in terms of females to males, maybe 60-40. So this will allow to have more female emergency medicine graduates, which will definitely have better outcomes in terms of career advancement for women in emergency medicine. I'm dying to know what our other panelists think about this issue. دكتورة سارة عندها تعليق. Go ahead.
السلام عليكم. يعطيكم العافية جميعا. يعطيك العافية دكتورة حنان، دكتور فهد، دكتورة حنين and all the amazing consultants. أنا عندي إضافة ونقطة بس تهمني إنها تكون يعني مفهومة بطريقة صحيحة. تمام. gender bias is there، لكن في شيء معين أحتاج أعلق عليه. تمام. لو كان مثلا ناخذ لي أنا كمثال، أنا مع الكونسلتنت حقي مع other colleague. لو ال other colleague كان مرة كويس وعنده skills، بينما أنا مثلا I'm not doing very well, I'm not focusing on myself، فيروح ال consultant يختار my other colleague، هذه ما تعتبر gender bias. تمام. وهذا دائما شيء أنصح فيه الجدد، الكتاكيت الصغار اللي حابين يدخلون الإمرجنسي ميديسن، خصوصا الفيميلز. حاولوا قد ما تقدرون أنكم تعلون أصواتكم، to be initiative. مشكلة أن مثلا أدخل على البيشنت ويحسب أني نيرس، من البداية يفضل أنك تعرفين بنفسك وإيش الرول حقك بالبيشنت كير. فهمتوا علي؟ ممكن عشان الإكسبيرينس حقتي شورت أنا ما لاحظت هذا الشيء، لكن every single patient أدخل عليه أنا أعرف بدوري وبدور الكونسلتنت اللي معي وماي other colleague. فهمتوا علي؟ نفس الشيء حتى بالنسبة للكونسلتنت، إذا مثلا في كونسلتنت معين he's not taking care of the residents, he is not supportive، فما هي كويسة إنه يتوقع آخر شيء إنه this is gender bias, they didn't choose me as the best consultant or the best teacher. فهمتوا علي؟ Do your part, do your best and always introduce yourself. وتذكروا حتى إن ترى في الحين awareness مرة كثير بمجتمعنا. صار في كثير ناس يعرفون فيه دكاترة فيميلز، إنه بناتنا كثير منهم صاروا دكاترة. فهمتوا علي؟ هذه النقطة اللي بس أتمنى أن الجندر بايس ما يكون شماعة معلقة لأي شيء مثلا يكون ناقص بالسكيلز أو يعني البيشنت كير مانجمنت. فهمتوا علي؟ أتوقع هذه يعني إضافتي لو في أحد حاب يعلق.
Amazing, Sarah. Thank you for highlighting this. This is actually an important aspect لأنه زي ما في الخير الشر فيه الخير يعني there are people and patients who thanked me specifically for being a female. الحين دكتور فهد يزعل مننا بعضهم قالوا لي والله أنتم أحسن من الرجال. فتصير ترى يعني في ناس they appreciate that you are a female. يعني يمكن الجادجمنت حقهم متحيز كمان يعتبر كمان kind of gender bias. But it will make you happy and cheerful during the shift if someone recognize that you are good and you feel يعني إنه في عدل في الموضوع وإنه الناس not biased to the opposite gender. other thing اللي سارة قالت عنه إنه مهم إنه فعلاً ما يكون الشماعة اللي نعلق عليها. It needs really a consultant or a senior that has good insight to know that his decision is based on the performance of the resident, not the gender of that resident. That's why awareness of the attendees about gender bias is really important. They have to consider it every time they are doing an evaluation for a resident. So yeah, that's it.
كلام من ذهب يعطيكم العافية. هل في أي أحد من البانelists who want to add any comments before we move on to the next topic? If you have any questions, please send them now. We've given more than enough time. I've reminded you twice in the chat section.
Doctor, we can move forward and then keep the questions to the end.
Sounds good.
الآن دكتورة بيان ودكتورة سميرة بيتكلمون عن الهراسمنت in the emergency department. تفضلوا دكتورات.
يصير أبدأ دكتورة سميرة if you allow me. I think a line between the harassment in the ED and gender bias, it goes in the same discussion. One of the things that I'm really hopeful about in في generation improvement. يعني when I talk about female in the emergency, they were they had more experience in the emergency, maybe 10 years more before me, 20 years before me. When they speak about their experience, yes, it breaks my heart, but I could see the improvement because they did a lot of work. They laid down a lot of rules, and they said no, and they stopped a lot of things. And I think with generation, with more time, there will be more awareness, and there will be less, hopefully, incident or less damage out of gender bias and harassment. The harassment, I wouldn't say it's it's particularly on female. The harassment in the ED is huge and in both gender because the emergency is exposed. The security service often are not fully equipped. There is chaos. There is so many kind of patients in most of the time in their worst case scenarios. in a lot of studies with numbers, it shows that like in the 90s, 90% or more of the physician in the ED, they experience some sort of abuse. And we're talking about verbal abuse, physical attack, sexual harassment, racial harassment. But all the studies, they were consistent with women were more likely than men to encounter sexual harassment. And in some situation, even more verbal harassment, just being seen as weak. And the assertiveness in men could be read as aggressiveness in female. But having said that, these are the area where I'm really hopeful. We have the tool to say no most of the time. The career advancement, that's a tricky one, because you can't say no, and you can't say just, promote me. I mean, you can say, but it doesn't work all the time. But the harassment per se, or the verbal confrontation, yes, you can stop it. But the subtle one, these are the ones that are really hard to deal with it directly. I think Hanan, she made it very clear. 1, 2, 3 are the point of how to address those. I just want you to be aware that it is there, and it is heavily there, more concentrated than other fields, but it's not paralyzing. That's not the issue that you would stop there. It will add on the stress. It will be part of your life. You thought about it. You think about the solution, and I would say it is more heavy in emergency than most of other careers. Definitely more in female emergentologists. But we can do it. That's not an issue. That's not an issue that could paralyze you. It's an issue, and it's a bad issue, and you don't like it, and we should stop it, but it's not paralyzing at the same time. Yeah, if Sameerah, you want to say something.
Thank you, Baian, very much. أنا يمكن the way I looked at it, and I wanted to talk about some tips to help يعني إن شاء الله ما حد يتعرض لهذه المواقف. طبعا harassment is زي ما قالت بيان, it's a wide thing. It's not physical. It could be physical, verbal, or sexual. ويكون لها different reasons, either due to gender bias, due to religion or race, or what, يعني for different, يعني it has different reasons. So يعني some tips I know, زي ما قالت يمكن بيان, إنه الشخص اللي يكون تعرض لمواقف مشابهة دائما they're reluctant to report the incidents that happens. So يمكن أول نصيحة أنا أعطيها لكم إنه you have to know what are the resources that you have in your organization. إيش الميكانيزم of reporting similar incidents. مرة مهم نعرف هذه النقطة, لأنه حالياً يعني صار من 2 يمكن طلع قانون اللي هو قانون مكافحة التحرش. فغير إنه بيكون في عقاب من المنشأة للشخص المتحرش, حيكون في عقاب عام من الحكومة, وهذا شيء واضح يعني. ويمكن هذا خلى كثير ناس تردع أو توقف من تصرف من تصرفات مماثلة. So أول خطوة you have to know إيش الميكانيزم حقت الريبورتينج في المنشأة حقتكم. مين الشخص اللي ممكن ترجعون تتكلمون معاه؟ هل هو الدايركتور حقكم؟ هل هو التشيرمان؟ هل هو العميد؟ It depends on your level. بس مرة مهم تعرفون مين الشخص who's to go, مين الشخص اللي أروح أتكلم معاه علشان أقول له عن المشكلة اللي أنا أواجهها. سوري reporting is very important. When you report it يعني أفضل إنكم you report it immediately للشخص اللي يستقبل الشكاوي المماثلة. في أغلب الأوقات حيطلبون منكم to write it write the incident. so مرة مهم إنه تكتبون الانسيدنت بالتفصيل، كيف صارت وإيش اللي صار والتاريخ الوقت الشفت الفلاني مثلا إيش اللي حصل، ومهم مرة تذكرون مين الأشخاص اللي كانوا موجودين وشاهدوا كwitnesses who saw the incident. مرة مهم إن you يعني after you report you need to be a good observant and see if this person سواء كان relative سواء كان patient أو كان زميل أو موظف موجود في المستشفى if he's dealing or having recurrent behaviors with other colleagues. مرة مهم إن if you opened up and spoke to زملائكم وأحد قال لكم إيوة أنا قاعدة أمر بنفس المواقف you need to stick together, you need to mention that in the report or in the incident when you're reporting it that you're not the only one, there are multiple people who are suffering from the same behavior اللي صدر من الشخص هذا. ومرة مهم إنكم تحفظون هذه الشكاوي تكون موجودة عندكم بحيث إنه يعني لو تكررت تصير أكثر من مرة تكون شكوى كتابية وتكون محفوظة في مكان يعني آمن عندكم. يعني مرة مهم تعرفوا إنه يعني الجلد شعور الجلد اللي يصير للشخص اللي تعرض لتحرش إنه هو كان عنده مشكلة أو أنا السبب، هل أنا تصرفت تصرف خاطئ أو أنا أعطيت لهذا الشخص أي تلميح سواء عن قصد أو بدون قصد خلاه يتجرأ ويتصرف معي هذا التصرف. يعني please don't feel this way. It's important to يعني الأشخاص المتحرشين يكون عندهم هم مشاكل يعني نفسية، فشعور الجلد هذا اللي يجي للشخص اللي تم التحرش عليه يعني هو شعور I would say الناس يعني شعور طبيعي يمر فيه الشخص كجزء من مرحلة الريكفري، بس مرة مهم إنه to speak up and seek for help إذا حسيت إنه it's affecting your life, affecting your social life and it's even affecting your performance at work. لأنه مهما كان you have to stay focused يعني at work. ومرة مهم طبعا أهم شيء is the support that you get from your friends and families. It's always a relief to speak to someone that you trust about what happens and listen for their advice, and this support system سواء من الفاميلي أو من friends it's very important. يمكن that's all what crosses my mind right now, and I'm happy to answer questions.
Thank you very much. التعليق الأول يعني صارت الامرجنسي ميديسن انترست جروب في جامعة الملك سعود مهمة لدرجة أن الناس صارت ترسل دعايات في الشات، فأنا سعيد جدا. هذا معناها أنه we've made it. النقطة الثانية وعلى الموضوع وهذا المهم يعني if you have any questions please send them now. I think this is an extremely important topic for everyone to know about. And I think this is your chance. If any of the other panelists have any further advice, please go ahead and share your advice and experiences.
I want to comment on this, Dr. Fahad, on the harassment in the ED. I think the most important or the first step in facing harassment is in ED or in general in workplace is to recognize it. Unfortunately, a lot of the women or ladies in any workplace are oblivious to the ways, patterns, and shapes of harassment. So it is not necessarily being like a touch or it can be in a form of joke and transforming a professional conversation into a sexual one, invading your personal space to use a keyboard or something. So women should be aware of all the types of harassment in workplace. If you allow me, I would like to link an article about this, about harassment. I will just
أهم شيء مو دعاية.
لا مو دعاية، ما عندي دعاية. Okay.
في سؤال من anonymous attendee. How do you prevent harassment in the ED? Or harassment in general, based on your experiences? What are some of the methods that you use to prevent harassment?
Can I just comment first, but then I will give it a chance for my friends just to finish. Yeah, I think the most important thing is just do what you need to do to be a professional in the workplace. You cannot completely prevent it, because part of it depends on the other what we call it party in this issue. It will depend on the other colleague or male that working with you, but just do your what you have to do, from like setting your boundaries through your appearance, the way you talk, and it's not only the harassment will not come only from colleagues who knows you. It can come from a patient, from a relative of a patient. So you cannot prevent it 100%. But the most important thing is when it happens, that don't allow it to continue, and just take an action. This all what I can say, and just be aware about it. We have a lot of programs now, governmental programs too, as Dr. Sameerah mentioned, to fight harassment in workplace. So you can log into their website. I will try to find it and link it also here, and see what is the process to put a limit to this problem. This all what I have about it.
Thank you very much. Any other comments from the other panelists? Any questions from the attendees, or should we move on to the next subject?
Doctor, I have a say on this topic على موضوع الهراسمنت. I think إن يعني الفيميل بشكل عام أو الميلز مفروض put boundaries between them and their colleague. وشو إنك you are irritable مثلاً، أو إنك يعني you are irritable regarding whatever you're having أو whatever you've been told في الemergency، سواء كان action أو words، على أساس إن الشخص اللي قدامي ممكن يحس إني أنا مثلاً متضايقة من هذا الأكشن اللي صار أو الكلام اللي صار. Otherwise, if I absorb everything happened to me in emergency, it will be continue. إذا كان هذا الموضوع لسه مثلاً مو قادر يوقف هنا، I can escalate it to يعني professional person. إذا أنا ما قدرت أوقف هذا الشيء في الemergency، خصوصاً إذا كان recurrent episode that can happen from يعني a specific person.
I agree 100%. This is what Dr. Baian, I believe, said earlier on. This is this is an explanation of what Dr. Baian said, and Dr. Hanan is set your boundaries early. So even if it's a small thing that you don't like, just say, make sure that you completely show the other person that this is not acceptable, so they understand that this is not acceptable. Otherwise, if you absorb it, زي ما قالت دكتورة إسراء, إنه they'll basically take it a step further, and you don't want that to happen. Any other questions or comments, or should we move on?
I just want to add one point. Having, to put on your shoulder to prevent it, I think it's too much, because the occurrence is almost inevitable. But that link very in a very entangled way with what Sameerah said about the guilt. Because if you think it happened to me because I could not prevent it, that's a cycle. The only way to go is down from it. What the physician said first, سميرة وحنان اثنينهم قالوا نفس emphasize the same point. Number one, if it feels not right, then most likely it is not right. Try to write it on your journal, in your own journal, as soon as possible after it happened. Because if it escalates or if it is repeated, repetitive move, then you have the documentation. Having per se to, on your shoulder to stop it by yourself and stand up for yourself is one way to do it. Reporting it is another way to do it. Knowing where to report, what is the policy in the same institute, in the same country. It's all a knowledge that we have to carry with us, around us. And not for you, but for people who is in power. I think a lot of gender bias and harassment talk has to be talked to male rather than female. They also need to be aware of it. I think they're more important to be sometimes need to be aware of it. A lot of comments and moves, I don't think they're really conscious of what damage what what they're saying. And that I'm not giving them excuses, but I'm saying more awareness, not just for female, for everyone, will help. And I think as a country, we are on the right track. Just know that you are empowered. You're not a victim, and you can do something about it. And it's not your fault, as Sameerah said. Yeah, they said the point.
Doctor, there is an important question, what to do if someone who's socially known or if I reported the action, I will not be believed, or I'll feel guilty because of the community and around me that support the other person.
That's what Me Too movement is all about. There is no one answer to every situation, with all the details, in every specific situation, but document it, reporting it. Now the issue of reporting it and what is the system is gonna support which way, and yeah, that's a tricky person, and that's what made the issue here until now, when we lived on Earth for 1,000 years now, and still we suffer from this. We've been together since Earth was born, but we still have those issues. It's getting less and less, or we are more aware of it. We are more empowered to do something about it or to stop it. But I can't deny that there is situation that yeah, it's disappointing sometimes. It is.
Thank you very much. Do we have any further questions, or should we move on to the
I just have one comment to the last mentioned question. I understand that it might be scary to be a harassment victim from a person who's well known in the organization, but what I would recommend you to do, I think you should speak to your family about the incident, and I encourage you, if you have your family support, to reported following the institution policy or the organization policy that you're working in. And I think جزء من الreporting إنه they maintain the confidentiality of the person who's reporting it. إذا ما طلعتي بأي نتيجة من الشكوى في المنشأة لك الحق إنك تشتكين في الشرطة، لأنه في حق عام وفي حق خاص وفي قانون واضح رادع للحالات المشابهة.
Thank you very much. Anna, my point is call them out. Just call them out. Don't be quiet about it. It's not your fault. It's not your job to basically raise everyone. It's the way they were raised. It's the way they think. If they're misbehaving or if they have, let's say, weird thoughts, it's not your problem. It's their problem. Call them out. Don't be quiet.
Yes, exactly. And especially if you see that the behavior is repetitive with different people, it's not only you. So you should know that the problem is in this person who's doing this action. It's not in you.
Agreed. Any other questions about this extremely important topic before we move on to the last portion of our webinar today? Thank you all very much. Let's move on to the last, but definitely not the least important part of today's webinar. It's going to be about emergency medicine residency for females in Saudi Arabia. And we have 4 of our residents in the training program in King Khalid University Hospital. Please direct questions about residency for females for Saudi. I'm pretty sure that our panelists who have done residency for Saudi will be able to help, but we'll focus on our guests for this topic first, and then we can move on to their comments later on. Thank you very much. And go ahead.
ذلك اللي يمكن if they want us to unmute them, they can raise their hands يعني عشان يصير interactive more. عندنا اليوم 4 residents 4 أطباء مقيمين في مستشفى الملك خالد الجامعي R3 و R1. طبعاً emergency medicine فيها 4 سنوات من الريزيدنسي. So we have 2 seniors and 2 junior residents. فخذوا راحتكم بالأسئلة. إيش تحبون توجهوا لهم أسئلة؟
Dr. Abeer, you're okay to go. Thank you very much for your time. We appreciate it.
Okay, I can يعني ask my first question. يمكن عشان مع زميلاتي بالعادة أتكلم بس إيش الإفكت؟ إحنا عارفين إنه الريزيدنسي هي أصعب مرحلة في تقريبا الكارير حقت الفيزيشن. فإيش الإفكت اللي مثلا تقارنونها بينكم وبين الأذر سبيشالتيز في السوشيال لايف بلس other medical specialties and non-medical specialties؟ تحسوا في differences ولا لا؟ يعني بالعكس أعطاكم وقت زيادة. بلس الquestions اللي جت اللي هي المنافسة لمقاعد residency. Is it competitive specialty ولا non-competitive؟ وتكلمونا عن الجورني حقتكم عموما في الامرجنسي ميديسن.
الشيء الوحيد اللي يمكن I appreciate موضوع الأوف دايز اللي عندنا الشفتات اللي هي 8 hours اللي تخليني I can يعني spend my day half of it مثلا studying, a part of it spending with friends and family. بس I don't have that much of experience. ما جربنا residency في السيرجري كيف أو في الميديسن كيف, so we cannot يعني give it a proper answer. بس يمكن غيري من الكوليجز عندهم different answers.
I just have a comment. Whatever specialty you will go in, during the residency you will face stress, long hour working, لأنه حتى اللي يروحوا مثلا يعني يفكروا إنه easy specialty أو مثلا specialty ما فيها ساعات طويلة, you will go to يعني do rotation in other specialty, بتداوم زيهم ساعات طويلة زيهم. بالنسبة للإمرجنسي I think إنه it's stressful 8 hours, بس بعد ال 8 hours لما اللي أشوفه من صاحباتي اللي يدخلوا other specialty we don't think more at what happened, أو مثلا أنا تاركة patient إيش حيصير عليه المرة دي جاية, فما في thinking يعني you will not think about work outside the work hours. هذه ميزة عندنا. وفي varieties إنك في الكيسز تتعلم كثير, تشوف في التخصصات, هذا البيوتي حق الامرجنسي ميديسن. residency without يعني whatever specialty في stress. مع الأيام you will get adapted to the stress, you will learn how to deal with it, وتدبند على environment حتساعدك. if it's a friendly environment it will يعني help you to pass this stressful life.
Whatever I mentioned before, التب اللي ممكن أعطيه للإنترنز أو الستودنتس later on, لا تفكرون بالفيز حق الريزيدنسي, لأن نفس ما قالوا الكونسلتنتس قبل it's a transient phase. أشوف إن تفكرون ما بعد الريزيدنسي what you will do later on, هذه بتكون البيرمننت أو اللايف ستايل حقك لمدة طويلة من حياتك. ف think of it as a future, don't think of it as a 4 years ولا 5 years of residency.
Thank you very much for your comments. We have a few questions. السؤال الأول, هل المنافسة قوية لمقاعد الريزيدنسي؟ Obviously this doesn't apply to females only, so it's for all, a general question. وبعدين في سؤال ثاني, when السؤال ثاني, if you as residents may talk briefly about the beginning of your journey in emergency medicine and what's your experience so far. Yeah, those are the two questions so far.
If you allow me, I want to add one more point. في the studying part in the emergency, it's heavy studying. يعني إحنا we have to know يمكن 50 or 70% of ophthalmology, ortho, gynae, peds, cardio, medicine, surgery, environmental, tox. A lot of يعني the studying part is, I think it's heavier عن باقي resident. And I was close to other physicians who were in a different specialty, not emergency. The working that they could do هم يعني بالنسبة لهم the shifting is out of question, لأن a lot of people when they shift they can't study well, they can't do the routine, and they can't have the production, and this is all personal, but the amount of studying is a big deal. And don't forget, it is high acuity, and you don't have a lot of time to review the case and to take 1 hour for the history and the exam, and to present it then to the consultant, and then to discuss for the outcome, and then put the plan. A lot of it is time sensitive. And so that's a special point in the residency. But I totally agree. Think about what happened after the emergency. I mean, sorry, after the residency.
I have a point نفس كلام الدكتورة بيان بالنسبة للstudying في emergency than other specialities. I think الدراسة في emergency is different شوي لأن as mentioned you have to know a lot of كل specialities تقريبا while doing other speciality يعني getting deep in one مثلا مو كل specialities بس مثلا ortho ولا ENT you get deep in تقريبا ما أقول إنها حصرية بس إنها it's way less than what we study or more deep يعني هذا يعني a very big point صراحة. الشيء الثاني اللي ممكن إحنا نفرقه عن other residents to be honest إنه we don't feel إيش أيام الأسبوع وإيش الويكند for us there is no weekend فاللايف ستايل حقنا شفتات أوكي صح في أيام تطلع أوفس ورا بعض بس ممكن من الشيء اللي يختلف إنك أنت you have to arrange whatever socializing مناسبات early on من أول ما ينزل جدولك ومن المشاكل اللي we can face it إن sometimes الجداول تنزل متأخر you have to arrange من بدري إذا عندك whatever يعني special event you have to attend إنك تفضي هذا اليوم أو تطلب request من قبل. هذا الشيء كل شهر يرسلون لنا زي اللينك نحدد فيه 3 أيام request وتقدم الإجازة قبل الروتيشن وممكن هذا الشيء يساعد يعني تقديم الريكوست من بدري. how we started أنا I feel في كمان نقطة حلوة مرة في ال ER residents أن usually ال ER residents أنا what I feel إنهم they become leadership skills عندهم leadership skills أكثر من other specialities لأن once إنك you're a senior which is R3 على طول يعطونك the feeling إنك you're يعني starting to lead the ship أكيد إنه فوقك في supervision but you start to manage the cases مين يطلع فوق مين يروح المكان الثاني مين يكون recess مين يكون acute care. I don't think in other specialities they got strong enough زينا في leadership which is يعني مرة valid point حتى بعد residency if you feel like you want to go administration ولا whatever يعني things يعني leadership skills أكيد بتساعد في أشياء كثيرة. This is what I wanted to add.
طيب دكتور فهد if you allow me to speak about the competition في emergency. طبعا الكومبيتيشن في موضوع الامرجنسي in general في الفيميل أو الميل it depends about يعني the year. كل سنة أنتم عارفين نسب القبول تختلف بس إنه يعني إذا كنتوا أنتم حاطين الامرجنسي يعني as a early thinking أو early decision you need to work for it in terms of إنه electives evaluation تاخذون من consultants recommendation research فهذه كلها بتكون باك اب لك إذا كنتوا أنتم ناويين على الامرجنسي. for example بس يعني brief experience أنا الانيشال كان توجهي general surgery وبعدين قررت يعني later on إني أدخل emergency وكان هذا الشيء يعني الديسيجن كان 3 months قبل التقديم فكنت I need to work fast وسبحان الله تسخرت يعني على طول كورسات على research once إنك أنت you achieve هذه الأشياء عندك في الCV it will give يعني interest للشخص اللي قابلك قدام إنك أنت you are interested more than the others اللي مثلا ما اشتغلوا على هذه النقطة. ف just pay attention على هذه الأشياء وإن شاء الله if you يعني making يعني 100% decision إنك you are want to be in ER ف you will get يعني a place. طبعا هذا كله يجي بعد الاختبار for sure إنه you need to compare مثلا آخر سنتين كم كانت النسبة عشان تشدين حيلك مثلا في الاختبار الجاي إنك you achieve this score specifically with the additive of the CV grades وهذه كلها بتساعدك إنك تنقبلين في السنتر اللي أنت تبغين.
أهلا أنا عندي إضافة على نقطة إسراء أنه ترى خلال السنوات اللي فاتت احنا ملاحظين في إقبال كثير من الفيميلز على الإمرجنسي يعني مثلا على دفعتي أنا احنا قبلنا 14 ف7 بنات 7 أولاد تمام يعني هاف صايرين بالنص بالضبط. من ناحية تجربتي أنا ما كان الإمرجنسي ميديسن يعني my first option كنت أورثو لين تقريبا قبل بداية الانترنشيب بشهر فجأة كذا قررت إني ما أحب أورثو استشرت أكثر من شخص فقالوا إنه ليش ما تاخذين اكسترا شيفتس بالامرجنسي ما هو عشان تحبين الامرجنسي، لا بس عشان تشوفين الكيسز اللي داخلها، بعدين تشوفين ايش الاشياء اللي انت حابتها، الاشياء اللي انت تتجهين لها، هل هي الميديكال كيسز، هل هي السيرجيكال كيسز. تمام. فتقريبا من سنة 5 أو على قبل بداية الانترنشيب بشهر بديت أخذ إكسترا شيفت، مرات نايت مرات إيفنينج، أشتغل مع دكاترة مختلفين. بعدين اكتشفت إني أحب الإمرجنسي نفسه، يعني مو إني أنا متحيزة لكيسز معينة. من بعدها I started early working on research. الelectives حقاتي كلها وقت الانترنشيب حولتها ل ER الإمرجنسي ميديسن يعني. والحمد لله I get accepted. بس إنها نقطة مهمة بعد again أعيد وأزيد فيها بليز يا جماعة، خصوصا الصغار اللي توهم جايين حابين الإمرجنسي وكذا، لأنها loud environment وتجي تروما وتجي arrest وفي a lot is going on. So try your best to be initiative, to be excited, to start discussion سواء with residents أو مع consultants. تمام. try حتى إنه you tell them early إنك you're interested بس عشان ينتبهون لك، فيحطون ببالهم إنه okay إنه this might be our future resident. أتوقع هذه النقطة حقتي، فلو أي أحد حاب إنه يضيف شيء.
يعطيكم العافية جميعا. أنا أشوف الأسئلة إلى الآن أحسها عامة على التخصص، ممكن لأننا صرنا مشهورين الحين في الEM Interest Group، ففي ناس ما حضروا أول محاضرتين. اليوم الموضوع specifically for women and emergency medicine، والفقرة هذه مخصوصة للفيميل residents بالemergency medicine. طبعا ليش جبنا residents حاليين؟ لأنه نبغى تجربتهم الآن live as they're doing it، وعشان كذا حرصنا أن يصير موضوع ميكس بين juniors وسينيورز، نتأكد أنه نغطي إذا كان في حتى تغيرات من السينيور ريزيدنتس في البروجرام إلى الجونيور ريزيدنتس. ففوكس your questions على موضوع ال females في emergency medicine و get them out of the way. Once we have more time we can actually get to the general EM questions. وفيما يسألون أسئلة إذا في شيء خاص منكم our residents على موضوع if there is any difference between yourselves and your female counterparts in the program, enlighten us please.
Again, Dr. Fahad, I didn't get your question.
أنا أقول إذا كان في أي شيء تحسون إنه في مختلف بالنسبة لكم أنتم كفيميلز في الإمرجنسي ريزيدنسي بروجرام مقارنة بالميل counterparts في البروجرام. This is what we should focus on now. وبعدها ممكن نجاوب الجنرال questions اللي تكلمنا فيها على الإمرجنسي ميديسن ريزيدنسي عامة.
ما أشوف إن في صراحة big difference في يعني residency between us as a females والmales as a يعني في residency practice في emergency. يعني ما في points في مخي إنه في a big difference between practice حقنا وحقهم. I feel it's the same يعني.
هل نفس الكلام اللي قالوه البريفيوس جيستس على المواضيع نفسها تنطبق عليكم الآن من ناحية مثلا الماترنتي ليف في الريزيدنسي nowadays، الجندر بايس في الريزيدنسي، الهراسمنت in the emergency department في الريزيدنسي؟ هل فيه أشياء أنتم تحسون أنها socially different than your male counterparts في الريزيدنسي nowadays؟ لأن الفوكس كان من البداية على الكونسلتنتس فالآن نبغى ناخذ وجهة نظركم أنتم to the same points within residency actively training now.
Dr. Fahad, I think there is a lot of ideas that يعني it's a myth in our heads, but it's not applicable in emergency. يعني sometimes نفس الريزيدنتس أو بعض الكونسلتنتس يحسون الريزيدنتس فيميل إنهم هم أقل من الميل as a practice wise، بس هذه يعني تكاد تنعد. يعني ما I don't think إن يعني our time currently is similar to their time previously. صاروا يعني أغلب الجنريشن اللي الحين موجودين الكونسلتنت صارين يعني أغلبهم young. They don't show us any difference من ناحية male أو female regarding the practice. We didn't يعني face that much of bias regarding the treatments أو regarding the feedback اللي يجينا من ناحيتهم, which is يعني a good point صراحة. That's it. Otherwise the harassment يعني it depends على تجربة الريزيدنس. يعني أكيد for sure not all the female residents they went for the same experience. But I think يعني whatever that has been said before regarding the steps هي اللي we need to follow. But otherwise as an experience ما عندنا شيء نضيفه يعني regarding this point specifically.
ممتاز، واضح، يعطيك العافية. طيب في سؤال، إيش المهارات اللي اكتسبتوها أو تعلمتوها في بداية البرنامج أو اللي تحسون أنه الشخص يحتاجها لدخول هذا البرنامج؟ أتوقع سؤال يعني مخصص للإمرجنسي ميديسن. أنا بجاوب. الدكتورة بشاير قالت أن الليدرشيب سكيلز حاسة أنها تفرق عندها مقارنة بالريزيدنتس في other specialties. تفضلي بشاير.
other than leadership أنا أتوقع من الأشياء المهمة اللي يعني person can improve to get into emergency medicine is يعني how to communicate with others و how to control your يعني reactions. Because في emergency medicine you get to talk to other specialities a lot, يعني to consult other specialities a lot. وحتى التيم as a team يعني you have to communicate a lot with your team سواء juniors or seniors or your consultant or the nurses. you have to get يعني communication skills. هذه أتوقع من أهم الأشياء اللي to get into emergency residency وعموما أصلا residency كاملة. بس يعني في emergency ممكن يكون a lot of consultations where you will get يعني مواقف مرة كثيرة تعصب أو تتعامل مع ناس يعني they're rude ولا the way of talking to them يعني بيكون صعب. بس you have to know إن أول شيء ما يأثر عليك personally، إن ما يأثر في نفسيتك أو في يومك أو في مودك، لأن it's يعني you don't have to make it personal. والشيء الثاني إنك you know how to answer this stuff politely in a smart way بحيث إنك ما تغلط على الإنسان اللي قدامك وستيل يعني you have your points. ما أعرف لو كانت الفكرة واضحة، بس الجواب حقي communication skills.
additive للنقطة اللي قالت لها بشاير موضوع leadership والcommunication skill برضه كمان solving problems as well. هذا الشيء it will develop from the first year of emergency resident، لأن في عندك problems specifically تكون مثلا your colleagues سواء وقت الشفت أو اللي بتسوي لهم consultation مثلا other departments أو حتى relative themselves. فبتلقون نفسكم موضوع البيشنت عندكم أو الصبر plus موضوع solving problems it will develop, which is برضه كمان a good part that will be added in your personality as well.
I think the skills, the important ones have been mentioned. You'll deal with violent patients. You'll deal with upset, verbally abusive patients. You'll deal with sick patients with concerned family members who reflect their concern in different ways. Some of them are violent, some of them are upset, some of them are crying, some of them are isolated, some of them just keep nagging with questions. So you definitely develop both leadership skills and communication skills. Another point that was mentioned by Dr. Bashayer is that you communicate with other specialties. So you have to, you'll know, I guess, by the end of residency, what the other specialties want to know. You'll know what to say when you talk to the other specialties. This, in addition to the medical part, are all of the skills that you develop during emergency medicine residency. One of the questions that was asked was, do you do rotations in other specialties? Yes, you do. I've answered this in the chat already, but just to make sure that everyone knows that we've answered these. And then one of the other questions was, does the doctor say that emergency residency is like a mix of medicine and surgery? And the answer was, you should know by the end of residency the emergent presentations for all specialties, because that's what you do as an emergency physician. And you do rotations in other specialties throughout residency, so you get a little bit of experience on the post-emergency medicine management or post-emergency department management of some of the cases that you'll see in the emergency department, which I think is beneficial. We've answered this last question about the skills. I think that covers all the questions. Does anyone of the panelists have any other points, whether specific to women or general, about emergency medicine that they would like to mention? If you as an attendee have any other questions that you would like us to answer, now is the time. I think we're already 21 minutes over the suggested time. So please let us know if you have anything to add now. Otherwise, we can close. Okay, so we don't have any more questions. I would like to thank all of our panelists, consultants and residents for their valuable contributions out of their very valuable time today. I'd like to thank Dr. Hanin and Dr. Nawaf and the EM interest group في كلية الطب جامعة الملك سعود for their amazing efforts in making this happen. And follow them on Twitter so you know about the next talks. I think the next one will be at some point next month. If you have anything specific related to emergency medicine that you want us to focus on in a talk, please let us know. You can contact the organizers, Dr. Hanin أو Dr. Nawaf عن طريق ال EM interest group on Twitter ولا by contacting them directly. If you have any comments or concerns, please let me know. If you let Dr. Hanin or Nawaf know, they'll make sure to pass it on to me. Thank you very much, everyone, and have a wonderful night.
شكرا لك دكتور، وكله بفضل الله تم السبورت العظيم اللي الجروب شايفه منك، فشكرا جزيلا. وشكرا لكل الكونسلتنتس والريزيدنتس اللي اليوم كانوا معانا. صراحة أخذنا كثير من وقتكم وما قصرتوا، لكن فعلا كان لقاء مثري وجدا استفدنا. شكرا لكم.